Good morning. I'm so pleased to be able to speak to all of you this morning, even though I can't be there. You have no idea how sorry I am that I'm not going to be with you today. You know that adolescent health and adolescents in general are very, very near and dear to my heart, and I'm really missing all of you. Unfortunately, I had a previous commitment that I could not change. So thank all of you for being here today and getting ready to roll up your sleeves and work on further development of our Adolescent Strategic Health Plan. As we all know, there is nothing more important to our communities and to our families than our young people. To use an old expression, they are our future, and I don't think we can overuse that expression at all. Here in New Mexico, we are depending on our next generation to continue to help our state thrive, also to work on the challenges that we certainly have here in the state. In many areas, we're doing well as far as working with our young people. In other areas, we're very concerned and worried. We're certainly worried about the dropout rates, as an example, and we're worried about a number of other high-risk areas that involve our young adults and our young people. One of the most important things I'd like to say this morning, however, is how grateful I am to all of you and to communities in general for the support that they give our young adults. It's always been a bit of an overused thought or myth that teenagers and young people waste their time, don't have very much to contribute, cause a lot of trouble, create problems. And it really is a myth. Most of our young people are active, intelligent, thoughtful, caring young adults who care very much about the world around them, contribute to their families, their neighborhoods, their communities, and are really preparing for their adult lives in very, very positive ways. We can't forget that, and we have to continue to show faith and support to our young people. There's sort of a message that becomes a self-fulfilling prophecy when adults inadvertently give negative messages to the young people in our communities, and we need to work as hard as we can to make sure that we're constantly sending out positive and supportive messages, which our teenagers have earned and certainly deserve from all of us. Many of you have heard me say before that we actually know the formula to supporting our young people and reducing the negative effects of some of the high-risk behavior areas. Let me go over those briefly because I believe in them, and I think they're reflected both in our current adolescent health plan and will be built into future discussions as well. First of all, we cannot be afraid to talk to our teenagers and young people about values and about ethics. Now that's the purview of our families and our churches, not so much something that our public institutions should be doing, but that is absolutely critical. We cannot be silent on the issue of values and ethics. We need to speak loudly and we need to speak clearly. We need to be reflective of our own personal values in our families, in our communities, in our neighborhoods, and in our churches. That is absolutely critical, and that raises the possibility then of creating partnerships with other agencies and organizations in our communities who are in a better position to speak about values and morals. Another critical area that I feel strongly about is comprehensive education. It doesn't matter whether we're talking about pregnancy or drugs or violence or mental health issues or suicide or any topic. We cannot be afraid to lay all the cards on the table in an open and frank and honest way with young people. They need all the information we can possibly give them on any of these areas. Certainly schools are the place to provide much of this education, since that's where our teenagers spend most of their time during daylight hours. But we also have to be sensitive to the fact that the schools are trying to teach reading, writing, and arithmetic, and it's hard for them to carve out time for all the subjects. So we need to find additional opportunities outside of the school environment to provide comprehensive education on any subject whatsoever. A very important area that affects a lot of our young people here in New Mexico is the issue of having self-esteem. You have to believe in yourself. You have to believe that there's a future. You have to know that your decisions are going to have an impact. So many of our young people who may be involved with addictions or other very serious high-risk behaviors, when you ask them, why do you do this, or why won't you change, or what's the problem, many times the answer is, what difference does it make? I have no future, so what difference does it make what I do today? And so that's highly reflective of the issue of self-esteem. There's many ways to support the self-esteem of our teenagers. Probably the most critical and most effective tool we have, though, is mentoring, which can come in many, many ways and varieties. Almost all of us remember when we were growing up having key adults who connected with us, who showed faith in us, who supported us, who were there to give us positive feedback and sometimes even negative feedback depending on our behavior. And all that was in the realm of mentoring, which we definitely have to continue to support. Another area we're all very clear on is that young people need to be kept busy. They need to be kept active and engaged, and there's so many ways to do that. But what we all see, I think, especially with our teenagers who are involved in high-risk behaviors, is a lot of hanging around, empty time, having really nothing to do, getting bored, and once they're bored, finding other ways to entertain themselves, which may not be terribly constructive or productive. And there's a lot of ways to do that. And again, here's an area where there's opportunities for partnering with other agencies in the community who may not have health as their sort of fundamental framework, but are ready, willing, and able to do other kinds of things to engage our young people in constructive activities. And finally, the importance of having services available to our young people is so critical. And the prime example, of course, are school-based health services. But we need mental health services as well as medical services. We need services relating to counseling. We need services relating to employment preparation. We need services relating to tutoring and supporting their education. Our young people need lots of various kinds of resources available to them to support and assist them when they need it. And again, there's opportunities here for partnering. So that's the formula. Values, providing comprehensive education, supporting self-esteem, providing activities to keep young people busy, and having adequate services in the community that they can access when they need it. Easy enough to talk about, easy to make a list like that, very hard to do in a comprehensive way, especially in some of our rural communities and in some of our economically depressed areas here in the state. So that's our challenge today, is to create plans to approach these things. Everybody in the room today are soldiers on the front line of this effort, I know. But we need to reaffirm our efforts because the challenges to people, our young people at this point in time, are greater than they have ever been in history. Thanks so much for being there today. Please invite me back to your next meeting, and do keep me in mind if there's anything I can possibly do to support your work. Thank you very much.